Hi, I'm Dr. Michael L. Johnson. I'm a board-certified chiropractic neurologist. I've been in practice in Appleton, Wisconsin since 1983. I'm the author of this book, What Do You Do When the Medications Don't Work? A non-drug treatment of dizziness, migraine headaches, fibromyalgia, and other chronic conditions. I consult with over 1,000 chiropractors across the country, and our website is lifechangingcare.com, lifechangingcare.com, that's one word. And I'm here today to talk to you about autoimmune conditions, and I will tell you up front, I suffer from an autoimmune condition myself, specifically MS. And I know some of you argue MS is autoimmune, it's not autoimmune, doesn't matter. An autoimmune condition is a condition where your immune system is attacking a body part. What is it? Well, there's rheumatoid arthritis where your immune system is attacking your joint. There is Sjögren's syndrome, where your immune system is attacking the moisture-producing glands. There's lupus, where your immune system is attacking the skin, joints, kidneys, and other organs. There's scleroderma, where the immune system is attacking connective tissue. There's Hashimoto's disease, or Hashimoto's thyroiditis, where the immune system is attacking the thyroid. There's Graves' disease, which is a hyperthyroid condition. MS, like I said, where the immune system is attacking the brain and spinal cord. There's celiac disease, where the immune system is attacking the intestinal tract. There's Addison's, where the immune system is attacking the adrenal glands. There's pernicious anemia, which has to do with red blood cells and B12. There's myasthenia gravis, where the immune system is attacking the muscles. There's dermatomyositis, where the immune system is attacking the skin and muscles. There's Raynaud's syndrome, where the immune system is attacking the joints. There's type 1 diabetes, where the immune system is attacking the pancreas. So a lot of different autoimmune conditions, and I'm here to tell you that what makes us different from every other doctor that you have seen, we treat you metabolically and neurologically. So you're watching this DVD because someone you know or love, or perhaps yourself, is suffering from an autoimmune condition. Their immune system is attacking a particular part of the body. So I'm here to tell you we don't leave any stone unturned when it comes to the exact cause of your condition. How do I treat autoimmune conditions successfully? I treat them metabolically and neurologically, hand in hand. You have to do it together. So what do we start with? On the metabolic side, we start with a complete lab panel. Complete blood work. What do I mean by that? Well, I've had people with autoimmune conditions come in and tell me, well, my labs are all normal. There are lab values that are very broad, folks, and then there are optimal or functional levels which are very narrow. Let's talk about the TSH level, thyroid stimulating hormone. Lab value is 0.5 to 5.0. Optimal level, functional level, is 1.8 to 3.0. You see, it's a lot narrower. So what do we want? We want a complete metabolic panel, not a basic panel. We want a CBC, complete blood chemistry with autodifferential, looking at red and white blood cells. We want to look at a complete thyroid panel, TSH, free T3, free T4, and total T4. And then we want to look at a lipid panel. We want to look at those lab ranges. We want to be as thorough as possible. You see, we can assess your thyroid, adrenals, liver, kidneys, red and white blood cells, and gut function with the above tests. If you have an autoimmune condition, then we need to look at these tests. If you have an autoimmune condition, we need to look at sensitivity testing. You know, I had a lady come in and she has just chronic fatigue, chronic pain. And looking at her, I said, you have an autoimmune thyroid. Your immune system is attacking your thyroid, just from her history. We run the tests, and the specific tests you run in that case are TPO and TGB antibodies. And normal TPO antibodies are 0 to 9. She was at 900. We run the sensitivity test. She's sensitive to everything. So if you're sensitive to gluten, milk, soy, eggs, and yeast, it's affecting your autoimmune condition. What is gluten? Wheat, rye, oats, and barley. So we need to run the test. You don't know unless you run the test. What are some of the symptoms of sensitivities? Chronic pain or fatigue, frequent indigestion, bloated after eating, frequent loose bowel movements, constipation, mouth ulcers, or they vomit often. You don't know unless you run the test. But if you're autoimmune, I can almost guarantee you you're sensitive to gluten. I'd bet good money on it, and I'm not a betting man. There hasn't been an autoimmune case yet that I haven't seen that isn't sensitive to gluten, and I've seen thousands. And the doctors that I teach all of this information to on lifechangingcare.com, same thing. We want to look at your adrenal glands. Your adrenal glands are your stress glands. They sit right above your kidneys. And this is measured with a salivary test, looking at cortisol levels at 8 a.m., noon, 4 p.m., and 10 p.m. We want to look at your immune panels. My God, yes, if your immune system is attacking a part of your body, we need to check it. So there's two parts to your immune system, Th1 and Th2, and they should work together. Th1 has specific blood chemistry markers, specifically interleukin-2 and TNF-alpha. If that's high, you're Th1 dominant. Th2 has specific blood markers, interleukin-4 and interleukin-10. If one of those or both are high, you're Th2 dominant. Th1 is T cells. T cells go attack invaders in the body, and then they clean up afterwards. There's helper T cells, suppressor T cells, natural killer cell activity, regulatory T cells, and macrophages. Th2 are B cells. B cells make antibodies. They tell the T cells what to go and attack. So if you're Th1 or Th2 dominant, you want to find out what's causing this dominance. And it's caused by one of two things, an active antigen or dysregulation. What's an active antigen? Parasites, bacteria, virus, mold, yeast, fungi, protozoan, foods. Remember the sensitivity testing? Chemicals and heavy metals. The best indicator for an active antigen as the cause of a patient's abnormal dominance is the T cell helper suppressor ratio, also called CD4 and CD8 ratio. If it's 2.5 and above, you have an active antigen causing it. If it's 1.2 and below, it's caused by dysregulation. You need to run the test. You need to check. H. pylori. H. pylori is a bacteria that could be an active antigen. You could have a problem with leaky gut syndrome. Leaky gut describes a condition of altered or damaged bowel lining caused by antibiotics, toxins, poor diet, parasites, or infection. If you have an autoimmune condition, we may look at neurotransmitters. We may look at hormone panels. We're going to look at inflammation in your C-reactive protein and homocysteine levels. And by specific metabolic testing, we treat it nutritionally. We also use glutathione. Glutathione is the mother lode of antioxidants. And then we treat the condition neurologically. So metabolic and neurological. Right hand, left hand, hand in hand. What are we going to do? Your brain and nervous system need two things to survive, fuel and activation. Fuel is oxygen and glucose. So we may use oxygen therapy, specifically exercise with oxygen therapy. Fuel and activation. As you age, your ability to utilize oxygen decreases by 1% per year after the age of 25. I'm 50 years old. I've lost 25% of my ability to utilize oxygen in my body. So I need to get on exercise with oxygen therapy. We may use an upper body ergometer. It's like a bicycle for your arms or an elliptical machine. We may use vibration. Vibration stimulates the back part of the spinal cord up to the cerebellum, up to brain. We may use auditory stim, listening to sound in one ear, increases firing to the opposite side of the brain. We may use olfactory stimulation, different smells affecting the brain. We may use visual stimulation. We may use an interactive metronome. You're listening to sound in a headset, specifically a cowbell, and you're clapping to that. It sounds easy, but it's measured in milliseconds. So, all of these things, once we have run the necessary tests to determine the specific condition, the specific cause, we can successfully treat your autoimmune condition, and I don't care what it's called, but we get to the cause of the problem. You know, alopecia, loss of hair over the entire body, is an autoimmune condition. It needs to be addressed. So ask yourself the following conditions. How has your autoimmune condition affected your job, relationships, family, finances, or other activities? How has it affected your life? What's it cost you in time, money, happiness, and sleep? Where do you picture yourself in the next 1 to 5 years if it isn't corrected? And finally, what is it worth to you? The reason I ask that is I'll have some autoimmune patients come into my office and they have sensitivity